I'm Al McFarlane. Welcome to the Conversation with Al McFarlane. I'm glad to be here and glad to have you along as well. Special kudos and thanks to our friends and listeners here at KFAI and to those who join us via the live stream on either YouTube or LinkedIn or X or Facebook. Wherever you are, we appreciate you. We thank you for paying attention, for being engaged in community, for being partners in building the kind of world that we believe we deserve. We believe that we can be co-authors, co-creators of. As always, we invite you to participate in this conversation. And as always, today's program, I promise, will be what I call a robust conversation. We're going to do that, but you can connect if you're on social media. Just drop us a note in the chat on YouTube or Facebook or LinkedIn. Say who you are, where you watching or connecting from. If you have comments, feedback, questions for me or my guests, that's the place for it. We encourage you to be involved and to let your voice go forward on this platform. I'm pleased today to open the program with a person that I just have the most amount of respect for and admiration for, as a matter of fact, for her pioneering work in the health field and as an educator as well. My first guest today is Dr. Brooke Cunningham. She was appointed in January of 2023 as the commissioner for the Minnesota Department of Health. And she, in that capacity, works for and with the Department of Health. She runs it. The health department is a state's lead public health agency responsible for protecting and maintaining and improving the health of all Minnesotans. And before being appointed commissioner, Dr. Cunningham was assistant commissioner for the Health Equity Bureau. She was appointed to that position by the former commissioner, Jan Malcolm. Shout out to Jan Malcolm, another great leader. She's also worked closely with leaders and staff at MDH's other bureaus to advance health equity in their work. So she's a general internist. She's a sociologist, assistant professor in the Department of Family Medicine and Community Health at the University of Minnesota. Prior to joining the health department, her research focused on developing strategies to reduce racial disparities in health, including addressing adverse impacts of exposures to racism. Dr. Cunningham, Commissioner, so good to see you again. Welcome back to the Conversation with Al McFarlane.
Oh, thank you so much for having me.
Let's jump right in. We've got 5 questions that I've shared with you that are on the table, and I want to have you take the time you need to go into each of these areas. The first question, Dr. Cunningham, is about the Minnesota Department of Health's new Office of African American Health. Tell me more about this office, what it is, why it is, and what's the vision and intent.
Thank you so much for that question. I am so proud to have been part of the origin story, right, for the Office of African American Health. We know, and even in my work when I was at the University of Minnesota Medical School, what I said and what I know everybody, the community talks about, we talk about all of the richness that Minnesota has for people, but also then we talk about the Minnesota paradox and how communities of color and Black folk specifically have not actually been able to have the same sorts of opportunities as other Minnesotans. And we see that play out in health statistics, right? When we look across the board at our health statistics, Black folk, Indigenous folk, we're always at the worst outcomes. And so with a lot of money that came into public health across the country with the COVID epidemic, and again, we saw what we saw with all other diseases, right, in terms of who was dying, and Black people were dying from COVID, and American Indian Minnesotans were dying from COVID. And so with some COVID funding, we were able to start first the Office of American Indian Health, but in the legislative session. So I came in, as you mentioned, to the department in 2022 as the Assistant Commissioner for Health Equity. That was critical, and we can certainly talk about sort of leadership at the state, but that was critical. because I was able to participate as an assistant commissioner in forwarding ideas, putting ideas forward for how we should ask for monies in that seminal 2023 legislative session. And looking at the health statistics, and we know, even though, as I say, health statistics, these are real people's lives that are underneath those statistics, is for me, with a listening, willing ear of Commissioner Malcolm at the time, was able to forward things like the Office of African American Health. And so we got the money in 2023. There's some startup, fits and starts that happen, but we're well on our way. And part of the thing that we do as a state health department, we do a few things. We do a lot of crunching of data, right? But we also do a lot of grants. And so we apply for grants from the federal government, largely. The state gives us grant programs, and we pass those monies through to partners. And those partners are often local public health departments, tribal governments, but also community-based organizations. And the one thing that we say here, and my colleagues have said for a long time, is we have to work with, partner with, put community in the driver's seat of what the solutions are. And certainly when I look at the health statistics that unfortunately have not changed. In public health, we talk a lot about infectious disease, and we've made a lot of gains in infectious disease. But when we think about chronic disease and we look at those cardiovascular disease disparities, or we look at stroke disparities, or we look at diabetes disparities, or we look at diseases of despair, such as substance misuse, when we keep looking at those numbers, the gains have been less remarkable. And so we need new ideas. And we need to have the humility as a department to welcome in other sort of creativity, other ways of doing things, to explore new ways of working. And this is what the office is meant to do. It's really meant to to be a mechanism, and there's a grant called Paths to Black Health. And that will continue. That is in the state budget. And so for all of your listeners who are in Minnesota and who are really working with communities disproportionately impacted by health inequities, and specifically working with African Americans, that is one pathway. All our grants are open, but Paths to Black Health is really to think about the cumulative factors that have led to these health inequities over time, and really to think about intervening in new ways.
I'm Al McFarlane. This is The Conversation with Al McFarlane. My guest is Dr. Brooke Cunningham. She's the Commissioner of Health, leading the Minnesota Department of Health. And we're talking about her work, her role, her vision. And, question number 2 in the series that you have before you, you've already started talking about Dr. Cunningham, and that is, how is the department working to advance community engagement and connect with diverse populations? And before you go on, I think it would be inappropriate not to, at some point in time, probably around this question, address the challenges of effective management of the public funds. And you and I both know, we're writing about it, but you're in the middle of it. The Department of Human Services in particular is kind of, at the epicenter of a lot of scrutiny about effective grant making and management of solutions. So how does your department stack up? Number one, how do you address the real concerns of leadership, of transparency, and of equity as you discharge the duty and pursue the vision of making this the healthiest state for all those populations, including the diverse populations? Big question, but flow however you want to with that.
Right.
Let's bring it all into focus.
No, I think we take that very seriously, right? We have to be stewards of public resources and use them in ways that are aligned with impact, but also in ways that are aligned with accountability. And these things are not incongruent, right? Compliance is not incongruent with equity. Compliance is not incongruent with having communities in the driver's seats for for these programs. And so we take that very seriously when we think about our own internal controls as an agency, but also when we think about how we support partners, right? Because whether it's somebody working at MDH or a partner that we're working with, we have to really position people with the right information, right? So they know what documentation folk need to submit, right? Because our partners are working hard. And the administrative pieces, we can all sort of bemoan the time that it takes to do the administrative pieces. But what I always say is how important that is, right? As we demonstrate impact, that we also demonstrate our accountability and responsibility with these funds. And so those two things go hand in hand. And it's something that, yes, there's a light on us as a state in this moment, but it's something that I and my colleagues across the state enterprise take very seriously.
And so let's go to the politics of it, which I think is in my view, Dr. Cunningham, the nasty side of it, the unfair side of it. And I think that, and you don't have to own this if you don't want to, but I'll say from my point of view as a journalist and observer, I am kind of appalled at the leadership, the what do you call it, the gaslighting from the highest office in the nation, from our president, and from what seems to me to be an intentionality in being dismissive, to dismantle engagement, opportunity, and to dismantle the idea that our people ought to have a voice in solving problems that we are impacted by, that we have not created. We are victims of it. And it seems like our leadership at the national level, the presidency in particular, is very, I think, intentional. I call this reminiscent of the end of Reconstruction. Here we go again. What do you think?
Well, I think, yes, there's a plan, right? There was a plan that was put out, right, pre-election last year called Project 2025. And whatever skepticism people had about how real that is, we have seen it be implemented. And folk are not hiding those things. And so we just have to, what did Maya Angelou say? Maya Angelou say, believe people when you see it, believe it the first time, right? When people show up. And so, I think for all of us, in community, we are struggling with all the changes that are coming down the pike that don't seem to prioritize the health and well-being of everyday people. Certainly don't recognize the challenges that have historically, that communities of color, Black communities have historically faced. And it's really interesting in this whole DEI rhetoric, the contortion and distortion that is happening in terms of what has been the solution to historical discrimination is now framed up as the problem. And you have to think, and I am not, I always say I'm not a political strategist. I think I have become more politically savvy in this role.
Sure.
But it is thought out, it is intentional, and there's some way in which that intentionality has been long-standing that I think I would say me as Brooke, under-recognized. And I think we who really want health and well-being for all people and recognize these policy levers that are being used to make that harder, now we have to work differently. I think we might have been caught a little flat-footed despite Project 2025. And so I think it is a lesson for those of us who have different values.
So let me ask you, Dr. Cunningham, to lean into your own training as a researcher. I came to a person, you might or might not know her, but I'll say her name because she meant so much to me, and that's Dr. Irma McLaurin. She was the founding director of UROC over in North Minneapolis. She's an anthropologist and a researcher. And one thing that I took to heart and to mind was her insistence that we understand what data-driven, research-driven decision-making means. And she acknowledged, as I had said and experienced and talked about frustration about our people being the victims of research, and victims of data. She said, well, if you let yourself be that, that's what'll happen. And if you begin to develop the tools, the knowledge, the skill to both create new knowledge, to examine data in the creation of new knowledge and new strategies, then you will demonstrate the ability to be an effective change maker in any environment. So my question to you is, with your background in research, how do you encourage us to understand, know, and value, and really benefit from ethical data and research? What do you think?
This is an interesting question for me, because I have an essay that I haven't finished writing called "If Only Data Were My Black Girl Magic." And so, and it's if only, because we talk about data, one, as if it is neutral, right? As if, and this is something that I think about a lot when people are talking about science versus politics, but there is often politics intermingled with the science, right? In terms of what questions get asked, in terms of whose input, who we sample for their input, in terms of how we interpret the data. And at every one of those points, there can be contestation, right? People can challenge, did you ask the right question? Did you sample the right group to get the right answer? And even if those things are yes, but are you interpreting the results correctly? And yet, because data is a tool in the policy conversation, I think we have to be engaged, but we have to be engaged with a critical lens, particularly when we know Black people, others have been systematically excluded from contributing to the canon or the body of knowledge that is that people most commonly go to when they are looking for evidence-based solutions and practices. So I think I hold them both, right? I hold them both, but I also recognize that people argue about what data tells us, and so, but policy making, there's argumentation that happens, right? And so it is a tool for you to come ready to say, well, this is what the data shows. And particularly when we just, coming off of our just previous question, right? We know what the history of inequities, social inequities are, health inequities are. We know what the causes of those inequities are. The data does show that. This is not random, and this is not just people's poor health behaviors and bad choices, right? This is the context in which people live. It's the context of that decision making, and it's actually the opportunities that people have where they find themselves, right? And so you have to be, it is a tool to come to the conversation with, but as important as what we think of that historical and often referenced and often quantifiable data is, the other piece of data that we all know, and you probably talked to Dr. Irma about this too, is the data that we have every day, from walking the walk that we walk, from knowing the stories of our own story, the stories of our families and friends, and so that is also data. That we have to bring to the conversation. I will tell you that actually is the data that is probably most impactful for policymakers. You can bring the numbers, but when you bring your story, I think that's what just how human beings think. That's what people hold on to more.
And so where does the story go? I mean, when you say that, I think about the question of believability and the narrative. What I do know, and what I think you will affirm, is that when Black women, for example, talk about pain, that the institution, the establishment, tends to minimize
Yes.
pain as expressed by Black women, but does not do the same with white women. And so, yes, we bring our story, our
That's
narrative,
right.
and if we
That's
tell
right.
it, and we still are met with a disbelief, what does that mean? And more importantly, what do we do about it?
Right.
Is
No,
that a
I
fair
think
question?
that is a fair question. That is a fair question and a real challenge. I would still hold that you carry both of them together because
Mhm.
people can't ignore the patterns in maternal mortality, right? They can't ignore who is actually dying in childbirth. They can't ignore the stories that Black women tell. I was just sitting with some folk last week, and we were talking about sort of how we wrap around Black women.
Mhm.
At home place, how we wrap around Black women, how we also wrap around their partners as people prepare for birth. And someone was sharing how someone who was at the table is pregnant right now,
Mhm.
and how people wanted to celebrate this new life coming into the world, but they were also worried for mom. They were worried because pregnancy is a risk for Black women.
Yes.
Right. And to your point, when you go into a place that is supposed to care for you, or when you go into any system that is supposed to care for you and you don't get listened to or heard, what does that mean? What do we do about it? And we have to hold those institutions to account. But it is hard, and I think we have made a lot of traction, which is why what is happening right now is so concerning. Because it took us a long time to bring attention to these patterns. It took us a long time for healthcare to open up to, oh, this is happening here with me, with my team, not over here someplace else. These patterns are right here with me and my team. And that took, I think, both sorts of data, but it took a lot of work for us to get there. And this is where you come to, well, if you're not believed, what are we supposed to do about it? Which is what I will say, which is where the power of community is, because it's not that that healthcare just woke up one day, for example. It is that we had shared our collective stories so often, including stories of highly visible, right? Serena Williams, other folk, right? Like people to gain a foothold for people to start paying attention. I think it is a hard road, but we have to continue to tell the story. And I guess I what it tells me is it took a lot, but the change, we have seen a change. Like, I'm not going to ignore that progress has happened in this country, even though there's a lot of work to be done. And I have to think that it was our collective stories, not just the data in a journal article, that made people pay attention.
As we wrap up, Dr. Brooke Cunningham, a couple of questions. I'll put them into one, and you can respond. So people who are interested in public health or influencing policy in their communities, local, state level, what kinds of things can they do? How do you become and reflect your own sense of responsibility to be a person that demands and pursues accountability, not only for yourself, but for the systems and institutions around you? And what opportunities are there to pursue? How they can, find out more information about how to be the most effective citizen, human being they can be.
I think, again, we keep talking about the power of, we just mentioned collective stories. When I talk about public health, I certainly say people power public health. When I move in political spaces like I do now, and I'm also a sociologist by background, so I do a little bit of participant observation is happening with me. But I see how people's networks matter because it gives you earlier access to information. you might get invited to a table that somebody else isn't invited to. And so the one thing that I would say as I think about any public health issue, any issue of policy significance is who also is lined up beside me, who I will tell my story, they will tell their story. We will all we will reach out across our networks to really build a coalition. I think coalition is incredibly important in the political space, but simply building relationship, and it can be one-on-one relationship to start. And so when I talk to folk about how to, for example, influence what happens at the Capitol, or maybe even influence the sorts of things or ideas we think about in our grants, or influence the governor's budget, having relationship with the people who make those decisions, and particularly for members of the public who deserve accountability, reach out, because the public sector, from sitting in this seat, I expect the people who work at MDH to be responsive. Mm-hmm. And I don't think that shifts. Like, I expect the public sector to be responsive to the public. So when we look at our programs in MDH, however we can find out who right runs the maternal and child health department, have they thought about this idea, and can I meet with you? People will meet with folk and say yes. And that is a way to start socializing ideas, whether they be grants or funding directions or a policy solution. And certainly we know it doesn't just come from the executive branch or a state agency or the governor's office, it also comes from our legislators. And so those reaching out to the people in the agencies, to the governor's office with interest in policy issues, to legislators, to committee chairs in particular, those are crucial people to get on a known basis, know folk personally, because there are many people who move in these political spaces where the legislature knows your name. Mm-hmm. And there's a way to make that happen. And I think they operate in many ways like I do as somebody in the public sector. They believe that they need to be responsive. Well, that is my experience of folk in the public sector and of our legislators.
Commissioner, final question. What are the biggest public health challenges facing our state right now? And I'll have you, if you would, make a call to action. Not a call to action, but an instruction. What instruction do you have for listeners, viewers, residents on how to be effective in your own health sovereignty?
Yes. When you ask me the biggest public health challenge right now, as an agency that is 50% federally funded, that passes those monies through to our partners, including community-based organizations, when the federal government withdraws from its obligation to not only be a funder, but to coordinate public health information, to bring together those coalitions that we have just talked about in the public sector, that is a huge, huge challenge. And we are having to fill gaps that we didn't expect to fill, not only on the funding side, but on the information side. And so if I am going to draw a call to action, we in the public sector, we don't tell you what to do politically, but health is political. And so, we got November coming up on us. Mm-hmm. And so to keep that in mind, these are not decisions made in a vacuum. There are interests and there are people who share your interests for the health and well-being of your communities, and they will need your support.
Dr. Cunningham, thank you so much. Let me shout out Dralandra Larkins. Her comment was a great comment. She said, given the disparities in Black maternal health outcomes, the Office of African American Health is so necessary. And she thanks you for your leadership and your commitment to this work. So I second that. Thank you, Jolanda, for that. And thanks to Anura C. Asar and others who are giving a heart-like to this conversation. Thank you for your work. I'd love to have you come back as often as you're willing to come back, and whatever we can do to help support getting the message out. I call this, Dr. Brooke, our mission is to create a public mind, a public understanding where we are connected in spirit and body and knowledge and in commitment to our shared humanity, creating that as how we roll, how we operate every day. So you're doing that from the policy point of view and from the administrative and leadership. We thank you so much for that.
Thank you so much for having me. Anytime.
All right. And we'll see you next time. Okay.
Thank you.
Take care. I'm Al McFarlane. This is The Conversation with Al McFarlane. Thanks to Commissioner Brooke Cunningham. What a wonderful conversation. What an important leader, an important voice in this community. Well, we're going to pivot to the second part of the program, but in the same spirit. Let me shout out Beverly Probst. I just see a note here coming on the screen. Beverly, thank you so much. He said, thank you, Commissioner. And Beverly, if you have other comments to make, go ahead and keyboard them in. Join the conversation. And if you have other people that ought to be in this conversation, just give them a call. Tell them to tune in, and they can keyboard their comments, their observations. We would love to have this conversation go forward. Beverly, we thank you for your leadership as well. Thank you so much. Well, who's here with me now for the balance of the program? Two people that I have great admiration for. Demitri McGee is here, and also Jeffery Robinson. And as you may know or may not know, we've had a partnership at McFarlane Media and Insight News with Build Wealth Minnesota. What a phenomenal solution-oriented organization, institution, process, strategy for addressing the long-term material and emotional, cultural health of our community, and I think by extension of humanity. You know, and while you here on KFAI always hear Al McFarlane talking about, Black interests and Black people, my objective, I hope you understand, is to talk about things from the skin that I'm in. This is where I sit, where I stand, and I don't apologize for that. But what I do remind you is that what I believe is that if I and if you are able to be your authentic and full self, we approach the work of living, acknowledging the gift that each of us brings to healing, to health, and to well-being. And if we do that as a matter of principle and as a matter of process, we keep positioning ourselves to be problem solvers. Well, Jeffery Robinson and Demitri, I think, are problem solvers par excellence. The Build Wealth Minnesota program is precisely that as well. Demitri, before I bring you in to talk about the new youth initiative, I want to go back to my buddy Jeffery, who I love hanging out with on this airwave because he always has powerful stories and jewels to share that motivate me and motivate our viewers and listeners. I think, Jeffery, give people Build Wealth 101. What's the mission? What's the vision? And how does your personal life fit into the conversation we just had and that we keep having?
So I'm Jeffery Robinson, Senior Program Director at Build Wealth Minnesota. And when I think about Build Wealth, I think about what you're able to build as a result of your obsession. And you mentioned that we have to be problem solvers. Well, to be a great problem solver, you must absolutely devote yourself to obsessing over the problem itself. Mm-hmm. Because it's only then that you're able to really create a solution that's tailored to all the many intricacies. Now, you won't be able to address everything, but getting to the core root of the problem, because a lot of times you can come up with solutions, but if the solutions only address the symptoms, but it doesn't get to the core, then you haven't created the solution. You actually just created a Band-Aid. And a Band-Aid for a gushing wound is not realistic. And so Bill Wolf, Minnesota, we provide financial education, one-on-one counseling to help you take what you learned and apply it directly to your goals. We are a coaching mindset. We counsel in crisis, but when you're not in crisis, we coach. We like to coach you through the process to make you the hero of this. I do not want to be the hero of your story.
Mm.
I do not want that. I want you to be the hero of your story. I want to be the coach in the background. I want to be, and I'm trying to think of a name of a coach right now, but I'm drawing blanks right now. I want to be Phil from the Chicago Bulls. Michael Jordan, they bring up Michael Jordan, but then you had the guy that was over there in the corner who was actually coaching the whole team, orchestrating the team. But it's the players who are actually performing. Those are the heroes. And so we provide financial education, one-on-one counseling. We are a lender, so we provide families with the access to the financial tools and resources that they need in order for them to assist them in accomplishing their financial goals and their dreams. We are a builder, so we build homes to help families that you don't own a home, you want to get into home ownership. Guess what? You're in the right place. We can help you with that too. First, we want to do is give you financial stability. Then we can build everything else, because you don't want to bring a house onto a foundation that's not properly set and cured. Otherwise, the house is going to be leaning to the side. The back door won't be able to open. A couple of windows, they're going to creak a little bit, but they're not going to get halfway open. And you're going to get into the bathroom, and the bathroom ain't at the right angle. The walls is doing this, and it should be doing this, And so that's where Bill Wolf comes into play at. And we address the issue from not just from the adults, but it's a holistic approach from adults all the way down to the youth, and tying it back into the conversation as it relates to health. I can say this, there's not quite stress like financial stress. Mm. And if stress is a big determinant of health outcomes, if we're not trying to address financial health, because money destroys relationships and the lack thereof. You don't have enough money and it's time to pay the rent or pay the mortgage, and there's not enough money in the account, that's stress. Mm-hmm. Kids got to go out of graduation. We're in graduation season. So now we're talking about prom. We're talking about graduation trips. We're talking about photos. All of these things cost money. And we're not talking about a necessity of life. We're talking about a necessity for enjoying life, but not a necessity of life. But I can tell you right now that there's some parents that's out there that's financially struggling, and they are trying to figure out, how am I going to come up with this money? Mm-hmm. And they're staying up late. They're conspiring. They doing, coming up with all different type of things in order to solve this issue. While at the same time, if money's keeping you up at night and you're not sleeping, okay, you know what? A lack of sleep, it leads to the same similar symptoms as high blood pressure. Lack of sleep can lend itself to memory loss. Now we're talking about dementia. It gives you signs that you actually losing your mind. Lack of sleep, you're not eating right. Mm-hmm. Stress prevents the digestive system from properly functioning at the level in which it was supposed to be functioning, and it creates cortisol inside your stomach. So if you got a belly and you're having a hard time getting rid of that belly fat, get some good sleep. Let's start right there.
Start there.
But in order to get that good sleep, it comes right back to what's stressing you out and what's preventing your body from actually relaxing, so that you can actually live the life that you were designed to live, and your body to do exactly what it's been designed to do, because it knows what to do. Mm-hmm. We just got to give it the necessary stuff in order for it to do it. And I'll turn it over to my buddy Demitri.
There we go. No, that's good. I'm Al McFarlane. This is The Conversation with Al McFarlane. That's Jeffery Robinson, who's the vice president at Build Wealth Minnesota. Joining us also is Demitri McGee. Now, Demitri is a HUD-certified housing counselor. He's a financial coach. He's a scholar. And he's also a youth community leader. He's got a master's degree from University of Minnesota's Family Social Sciences Department. His academic research focused on developing and evaluating effective financial capabilities for underserved and underrepresented communities. He's published multiple articles that utilize his research findings to enhance efforts to assist local nonprofit Financial Opportunity Center, Build Wealth Minnesota, and other organizations in the field. And for the past 9 years, he's worked as both a youth director and housing counselor, financial coach at Build Wealth. He's been fortunate to assist hundreds of families and youth in developing various financial skills, including budgeting, saving, credit building, home buying preparation. He's also authored and coordinated the Youth Stabilization Program and Rental Readiness Program. It's called Rent Smart, Wise, and Ready, which are programs offered at Build Wealth. And so, Demitri, thank you for being here. Thank you for your work. You know, when people think at the top of the head about Build Wealth, you think about families or grown people, you know, and grown people in my mind, 30 years old or older, who are ready to move into home ownership. But what you are saying is that it's not too soon to talk to young people about financial health and wellness and preparedness at a young age. And you are now moving more into that arena in the programmatic level at Build Wealth. Talk about what you're doing, what the vision is.
Yeah, no, thank you, Al. That was a really good intro you did just there. I don't even gotta say nothing else about myself. But yeah, when it comes to youth, like we always think of like you said, the adults, and that's kind of the breadwinners, the one that are going through the financial trauma, financial stress. But when we think about youth, and me as a counselor, even coaching somebody that has not learned how to be financially responsible, coaching someone that's already gone through the issues with credit and spending and debt and things of that nature is a lot more difficult to kind of reverse that behavior piece. And Build Wealth, we use therapeutic measures in order to do so, to change the behavior. What I found is we become what's more like an intervention for adults and for families to change behavior, because that's really how you better learn and manage money is behavioral change. So when we created the Youth Stabilization Program, we thought more or less about intervention, but how can we initiate prevention? So before you even get into those issues, before you even deal with the credit and all those things, let's find a way where we can educate young folks so that before you even get a credit card, you know what credit is. You know what bad credit is, you know what good credit is. You know how to build it. You know about things like identity theft. You know about things like budgeting, money management, banking, consumer protection, which is probably one of my favorite lessons to teach, because we can teach all of the good stuff and this is what you do with money and all that, but how do we protect ourselves every day? Because it's inevitable for things to happen, things like identity theft, especially with the community we serve, where I see a lot of spaces where folks are victims of identity theft. And I always ask folks, who is most likely the one to be involved in identity theft, or who to steal your identity? And folks will say scammers, they'll say all type of folks, but then the reality is it's typically a family member or one close to you. So then we, kind of teach about what you can do, methods and things of that nature, so that they're equipped not only with the knowledge on how to build financial stability, but how to protect themselves while building and creating relationships with banks, with creditors, with housing providers, and understanding these things. So once you are 18, you hit the ground running. Just the other day, I had a presentation at Hopkins High School where we had a housing presentation. And just like how we teach the adults about housing. We of course teach them about what it means to be a renter, but let's start this conversation now about what it actually takes to be a homeowner. I get 30 and 40-year-olds that don't know about home ownership and what it takes. But imagine if you're 16, 17, learning these. So straight out the gate, I'm cognizant about keeping up with my credit. I'm cognizant about being employed for a couple years and all these things it takes so that home ownership is no longer scary. We get a lot of folks, especially that look like us, that are scared of home ownership. It sounds hard. It sounds like it's a long time. It sounds very time committing, which it is. However, I tell them, would you rather build your own equity up, or would you rather pay rent for years and build someone else's equity? And I ask the class, like, what do you guys think? And it's like, my own. So teaching them things like that so that they're well equipped is really my biggest goal with the program. And we'll be taking it a step further this summer. We'll be launching what's called She Builds, as well as a program called He Builds.
Okay.
So with those programs, of course, we'll build wealth. We got to talk about finances. There's no way around finances when it comes to these things. But going back to kind of what Jeffrey was saying, there's other things that are happening in these young folks' lives that surpasses just understanding money. The whole idea of identity. Who am I? What do I actually want to do? What people do I want to hang out? How do I manage relationships? How do I balance work? How do I take care of myself? How do I properly groom myself? You know, things of that nature play a part in getting good grades, having a job, and being in sports. So She Builds and He Builds takes it a step further in those areas where, yeah, we're going to talk about finances. We're going to talk about college. We're going to talk about careers. But let's talk about you as an individual. How can we build you up? Hence the name. How can we build you up as an individual so that you understand yourself better, so that you can properly groom yourself? So when you're in these spaces, these interviews, you know when to wear a suit and when to wear a t-shirt. You know how to keep up with your hygiene, which I'll it's unfortunate to say it's been something that I've seen as I'm going to school. It's like, you know, we gotta give some folks some deodorant and some toothpaste and things of that nature.
Right. Yeah. The basics.
For some folks,
Yeah.
some young youth, they're not getting that conversation that we may have had with our parents. Not everybody's blessed to have a David McGee as a father to teach you about these things, how to tie a tie, how to do those things that you think are little or minimal, but now you get in a space with She Builds and He Builds where we talk about it. What I like to do, and I'm sure Jeffrey agrees, Build Wealth is trying to create this nice little space we got up here. I know, Al, you've been here. We're trying to create a safe space, not only for adults, but for youth to be able to come into the space, speak their mind freely, learn about themselves, learn about finances, get resources, and be able to build a community within each other. And I say if we do that, it grows a stronger community for the future. And hopefully they continue to come back. And me personally, I tell kids right away, I like writing letters of recommendation. So think of me as not just a mentor, but somebody in your corner, resource. Okay. You'll see Jeffrey in and out. He's a resource. So how do we utilize these resources? How do we build ourselves? How do we keep ourselves in a space where, like, the money's going to come either way, but how do we put ourselves in position to live a fulfilling life? If you don't understand yourself, it's really hard to understand what kind of career you want to go to or what kind of college you want to go to. So,
Demitri, I'm interested in why you sort of bifurcate the title or the program. Let me explain that, why it's He Builds and She Builds. What's the reasoning behind that? And as you answer that, talk about the intended audience and how people can get involved. I think I noticed that your program is looking to work with middle school and high school students. So go into that. Why this group, and what do you hope you've said it already, to say it again, to have them grow into understanding of by being and becoming community.
Exactly. That's really good. See, good question, Al. So the term he builds and she builds. So I'll start there. They're separate, right? So one specifically a boys group, one is specifically a girls group that are concurrent. So the girls group meets at 1:30 to 3:30. Boys group meets at 3:30 to 5:30. So we keep that separate, and we find instances for field trips where we intermingle. And they all may go to the Federal Reserve Bank or go on a college tour together where they'll, see each other. Where the name comes from, I'll give a shout out to Miss Tyra Blazik, who was a youth coordinator here at Bill Well. We had just been going to so many schools, like going to high schools, middle schools, and we connect with students to where, we're teaching you finances, but some of these students, they seen us as folks that they're comfortable with, where they're talking to us about their teachers, they're talking to us about their little relationships and things like that, to where there's a relationship being built. So Tyra and I, after being at, I want to say we're at Camden High School, we had a conversation where she was fired up, where she's like, man, I just wish that we can do more. I wish we can do more to help build up some of the young ladies, because it started with the young ladies because they love Tyra. And we went over some names. She's like, how would you feel if we started like just a girls group where we focus on the young ladies? And we went over names. I said yes. We went over names, and every name we went over had build in it. So we ended up taking that piece, and then Tyra's like, how about we go with She Builds? And she went through, she came up with logos and all type of things that looked phenomenal. So we ran with it. I had her create a curriculum around it that takes them not only through financial literacy, again, grooming, hygiene, relationships, things of that nature. And then I had her set up presentations. We pitched it to the whole Build Wealth team that had input throughout the whole thing. They're like, we love this. We believe in this. This is something we think will hit really well with young ladies. And then my father, Dr. David McGee, is like, okay, what about the boys? So we created really like it's symmetrical, it's something that kind of matches, but rather than talking about that time of the month for young ladies, we're talking about the grooming piece, clipping your toenails, getting your little peach fuzz together, things of that nature. And that's really where that came from. We chose middle school and high school as kind of that frame because that's where we're seeing the most need. So especially with the middle school age, I would say where there's
what's the age group in middle school? That's what, 6th, 7th grade, 5 through 7, or 6 through 7?
Yep. So we're thinking 6. The primary age group we're thinking is really 6 through about 10th or 11th. But because those are where they're, for lack of a better word, moldable. Like you're not, our seniors, they think they're grown. So they
Well, I think this is really important that you're doing that. So I'm thinking the 6th graders are 12 years old, roughly, right? 12 years old, 13, between 11 and 13.
Yeah.
So, I think too often we tend to undervalue how aware these young people are. I believe that young people are conscious of the space that is around them. They're conscious of what's happening in their families and community. They're conscious of what's happening in the news. Maybe they don't watch the 5 o'clock news like we do as adults, but they are generally aware. And I believe that they are conscious of and capable of being conscious of understanding the reality of the global order, right? And so if we don't value the genius, the gift that they bring and that they're developing into, we are shortchanging them and shortchanging ourselves as well. And so to the degree that you bring seriousness, not only to the personal, practical, hygiene and relationship, but also a respect for their capacity to understand the big picture, as they are developing and maturing into young adulthood. I think that's phenomenal. And I think it's amazing, absolutely amazing, that you are bringing an intentional conversation about wealth building and practices that will lead them towards being effective stewards of their own lives, their own families, and therefore our community, and therefore the world. What do you think?
Yeah, no, you hit the nail right on the head. I love that aspect of it as well, because like they're smart. Like give them an electronic device, they can work it better than we can. Let's just be honest about it. And also pairing them with the older kids, also they look up to these 16-year-olds, to where if you see this 16-year-old sitting down and tying a tie, it's going to make your 12-year-old, 13-year-old want to mimic them. So there's a level of mentorship that goes into it there, where we, 16-year-olds looking at me as a 30-year-old, but then that 12-year-old is looking at that 16-year-old. And now if we get them collectively in this space, now the 16-year-old goes off to college, and now a person that's at this college, a person that's there just before you, that continue to mentor you outside of just a Demitri. But now you got this community where folks are going to college in different spaces, and these are folks in your phone that that can give you these stories, that can give you these resources. So the knowledge doesn't stop at Demitri. The knowledge continues to grow with you guys as a community and as a cohort. So that's why I think this age group is a really special group, and they're the future. And I want to prepare them to take it by the reins, so that they're not unequipped with anything. I need you guys to be homeowners. I need you guys to build well. I need you guys to take the foundation we set, and let's elevate it. Don't see us here and stop here. Let's keep going ahead. And with me as a father of a 7-year-old, I need y'all to make it better for my 7-year-old.
That's right.
So we got to continue this thing so that we don't go backwards.
How many young people are in the program this first cohort, and can people still get involved this time, or what's the schedule? We got about 2 minutes left.
Yes,
how do we get people connected?
Yep. So we're finishing up our last YSP class today. So that graduation is today. We have about 9 students in there. For the summer, I want to say we have about 20 to 25 youth signed up as of now. It doesn't start until late June, so there's definitely more time for them to sign up. Sign-ups stop first week of June, so there's still some leeway to get in.
How many slots do you have? How many people can come?
We got 50 each. So
okay.
50 each. So we got plenty of space. It's $150 to participate. There's about 18 sessions, so 9 weeks, 2 sessions a week. Think of that as $8 or so a session for you. We provide food, we provide a safe space, and then we are still fundraising as well. So for folks that really need it, we want to try to provide a way. We do payment plans, we do all that good stuff. We don't want anybody left behind that actually wants to be in the space.
Okay. Well, listen, let's give a phone number out. People that want to connect. You can also obviously go to Insight News every week. We've got promotional material in Insight. We'll be promoting this as well. But for those who are listening, who can they call? What's the number and what's the web address that they can call to get more information?
So what I'll do, I'll give my email as well. But I'll start with, I'll just shoot them to Tyra. Tyra's number is 612-800-5978. And then her email is Tyra Blazek, TYRABLAZEK @BEALTHE.org. And then if you want to reach out to myself, similarly, Demitri, DEMITRI @BEALTHE.org.
Guys, thank you so much. We are out of time. What a wonderful conversation. As always, Jeffrey, so good to see you. And we'll keep having this conversation over the summer. I want to make sure that we track with you. And to the degree that it's possible, we'd love to have some of the young people who are involved in the program on this program, sharing their experience. So we'll make that happen, okay?
All right, let's do it.
Thank you so much. We'll see you next time. I'm Al McFarlane. Take care.